Hi everyone, Dr. Rosado here with BioCure Integrative Medicine, and I want to thank you very much for registering for this webinar. Hopefully you learned a little something today about testosterone replacement therapy, and that's what we're going to be talking about today. I get asked a lot of questions at the clinic, so I wanted to just briefly touch upon a few things that I hear a lot about, and different misconceptions that I hear about testosterone replacement therapy. So we're going to be talking about TRT, how to do it the right way, and why not all programs are created equal. So a little background about me. My name is Dr. Joaquin Rosado. I've been a wellness consultant for well over 10 years. I am a board certified practitioner in anti-aging medicine. I did some postdoctorate fellowship in anti-aging and functional medicine. I'm a board certified chiropractor and physiotherapist. I'm also the co-owner of BioCure Integrative Medicine here in South Florida, as well as Strategic Health, which is a concierge service that we provide for homes. So today's agenda, which we're going to be discussing, is a little intro on what testosterone is. So obviously we're going to be talking about replacing it. We need to know what it is. We need to know who needs it. We're also going to be talking about different symptoms that people suffer from when they have a deficiency in testosterone, as well as what causes those deficiencies. We're going to discuss why and when we should use testosterone replacement therapy and different alternatives, because not everybody needs testosterone replacement therapy. So we're going to talk about different natural alternatives that you can do to increase your testosterone naturally. The different pros and cons of testosterone replacement therapy, and again, why not all TRT programs are created equal. So first thing we're going to discuss is what is testosterone. So testosterone, as we all know, is predominantly found in higher quantities in men, right? So it's produced in testicles. So testosterone is essentially what helps maintain men's bone density, the fat distribution, more muscle strength and muscle mass. It obviously improves your higher testosterone levels, gives you better sex drive with better erections and more sexual desire, as well as what maintains your facial and body hair, and helps produce different cells in the blood. So the biggest question I get when a man comes in with their labs is, "Doc, what happened to my testosterone?" And I hear this question a lot, and it's crazy how most of the times when we think low testosterone, we think men in their 60s and 70s, but truly I get a lot of patients coming in, predominantly the patients in their 30s and 40s coming in, and their testosterone levels are essentially cut in half from where they were just a few years before. So unfortunately, this is a very common and very expected process in life and in aging, and it is that testosterone in males after the age of roughly about 30 drops usually between 1% to 2% every year from that point for the rest of their lives. So obviously you can see how those numbers start to drop significantly as the years go on. So the most common symptoms that you could expect with low testosterone, actually the number one that I hear in the clinic and what prompts people to come in is, "Doc, my energy levels are on the floor. Like I have zero energy and I always feel fatigued." So that is the number one most common symptom with low testosterone. Besides the obvious, which is, changes in sexual function. So you don't have that sexual desire anymore, or you can't perform the way you used to. You might be seeing some physical changes. So increased body fat kind of in the chest area, or a decrease in muscle mass. Even if you're working out and training the same, just the muscles it's just disappearing, right? And different emotional changes. So I hear a lot of patients coming in, they have brain fog, they feel like they don't have any mental clarity, they could feel sad and depressed and low in energy, as we mentioned. So those are all very common symptoms that you would expect when you have low testosterone. So the next question I usually get is, when should I start testosterone replacement therapy? And the truth is, there's no magic age to start testosterone replacement therapy. Clinically, we have to look at you as an individual, and everybody has to be looked at as an individual. It's not a cookie cutter approach. So we look at symptoms that the patient comes in with, but also the labs. If the labs show low testosterone and then all the symptoms line up, then you could very well be a good candidate or even think about potentially doing testosterone replacement therapy. I can tell you roughly at the clinic, upper 30s, kind of mid 40s is usually where we start seeing patients feel like they've tried everything, all the alternatives that we're about to discuss in a little bit, and that would potentially prompt us to start on testosterone replacement therapy. But at the end of the day, the truth is there's no magic age where somebody should start testosterone replacement therapy. So first, before we jump into actual testosterone replacement therapy, let's talk about the alternatives, right? So a lot of these are going to be pretty common sense. However, sometimes we just need to be reminded of the common sense options. So an improved lifestyle, right? So eating a proper diet, and that means no fad diets, no carnivore diet, meat only, no paleo, no keto. Just eat a well-balanced diet. There's no right diet for everybody. So this is the best route to take, is everybody should be on a well-balanced diet. Eliminate the stuff you don't need, such as simple sugars, right? Such as, for some people, lactose and gluten, right? But not that carnivore diet or paleo diet or keto diet doesn't work for some people, but it's just one of those things that it may not work for you. So just kind of talk to your doctor, see what might be the best route for you to go, and try to go that direction. Exercise. So when I say exercise, I don't mean necessarily just cardio. Cardio is very important for a lot of systems in the body. But when we're talking about increasing testosterone, when we talk about exercise, we mean lifting weights. So resistance training, whether it's band work, whether it's going to the gym and lifting some dumbbells and barbells. It's lifting weights and resistance training that's going to help increase testosterone production in your body. And then lastly, in the improved lifestyle category, is sleep. This is one of those things that's so commonly overlooked. There's a study that shows that men that sleep 6 hours or less per night have a 15 to 20% lower testosterone than men that sleep 7 hours or more, right? So just let that sink in for a second, and that'll kind of give you an idea as to how important sleep is. Obviously, sleep is important for testosterone, as we just mentioned, but for everything else in your entire body as a whole. The next option or alternative for testosterone replacement therapy is peptide therapy. So we do a ton of peptide therapy at the clinic. As a matter of fact, there's so many peptides, I couldn't even put them in a slide here. So if you go to our website, www.getbiocure.com, you'll be able to tell here on that page. We've got a lot of them laid out there for you, what they are, what they do. But essentially, a peptide is a chain of amino acids in a specific sequence. That specific sequence of amino acids causes an action in your body. For instance, something like sermorelin or CJC, which is a peptide that actually helps your body or stimulate your body to produce more human growth hormone. Human growth hormone is very important for maintaining the body's youthfulness, right? It's the anti-aging hormone. So it'll help improve muscle tone. It'll help decrease body fat, help you sleep better. So that's very important to know what it does, but know that there's other options out there other than just injecting testosterone, right? The next one is the most important, arguably the most important vitamin out of all the vitamins, and that's vitamin D. Vitamin D, it's obviously known for helping, bone density and stuff like that. However, it helps with brain health. It helps with, it's pro-hormone, so it helps with your body producing more sex hormones. So essential to intake sufficient vitamin D and to take in some sunlight pretty much every day if you can. 15-20 minutes is usually sufficient. Now, with vitamin D, you want to make sure you're not just overdosing on vitamin D. So that's why it's very important to get some blood work done to make sure that your levels are where they need to be, right? And then there's other herbals such as ashwagandha and tribulus terrestris, which have been proven for years upon years to help improve the production of testosterone in men, along with DIM. DIM is actually a chemical compound found in cruciferous vegetables, so cauliflower and broccoli, and they can isolate it pharmaceutically, they can isolate it into high amounts. When you take that has been shown and proven not just to help your overall health, but also help balance out your sex hormones. Now let's talk about the pros and the cons of TRT, or testosterone replacement therapy. The pros, most people already know. It'll increase libido, it'll give you more energy, it'll help improve the symptoms of erectile dysfunction, it can increase your sexual satisfaction and sexual desire, it can increase muscle mass, decrease body fat stores, it can help stimulate some more mental clarity, and also just give you an overall sense of well-being, right? The cons are usually more prevalent when you're not getting monitored correctly by your practitioner or the clinic where you're doing your testosterone replacement therapy. So testosterone therapy, when not monitored correctly, has been shown to worsen sleep apnea. It can cause acne, right? On the chest, and the face, on the back. It can stimulate non-cancerous growth of the prostate, also known as BPH, or benign prostatic hyperplasia. And what that is essentially is just your prostate just swells up a little bit. That's where you start having to go to the bathroom more often. Again, it's non-cancerous, but that's usually not an issue if you're being monitored correctly. It can also cause enlarged and sensitive nipples. It can cause your testicles to shrink, because when you're taking testosterone, your body's natural ability to create its own sperm and testosterone starts to diminish unless it's being done properly. So there's different ways and things you can do along with testosterone replacement therapy to stop this or eliminate this or restrict it from happening as much. Also, it increases red blood cell production. So it'll increase something called hematocrit. Essentially, hematocrit is what makes the blood thicker. So if you have thicker blood, you're more prone to having cardiovascular disease. You're at a higher risk. So again, that's if you're being monitored, that is very easily fixable or correctable. If you donate blood every so often, if you do what's called a blood dump, you just go into the clinic and basically just take out, between 200 and 400 milliliters of blood from your body will create new blood, and it won't have that excess hematocrit thinning out your blood a little bit. Therefore, you're at a lower risk of cardiovascular disease. So when it's been already established that you have low testosterone by looking at labs, but also clinically, you're showing some signs of deficiency, there's usually a few options, right? So option one is you continue living as usual, right? You just chalk that up to aging and you just deal with it. And unfortunately, a lot of people, that's the route they decide to go. They're like, well, I guess this is what I'm supposed to be feeling like because I'm getting older, right? And that's an unfortunate thing, but that happens a lot. And that is an option, right? That's a viable option. Option number two would be trying a natural alternative, peptide therapy, some sort of nutraceuticals or homeopathic medications, and supplementation. That's option number two. And then option number three, if you fall in all the categories and your doctor decides that maybe testosterone replacement therapy is something you should consider, then testosterone replacement therapy is also an option as well. So what I like to talk about, and this is just one of those things that I pride myself in being a 5-star clinic with over 100 reviews. And the reason for this is the following. We really, really do take our protocols to the next level, because I treat, and all of our practitioners treat our patients the way we would want ourselves and our family members to be treated. So when it comes to testosterone replacement therapy and the protocols that we put together, we demand better, right? I am a consumer of healthcare, so I demand the best from my practitioners. So you should do the same. You should never feel obligated to do what a doctor says. You should do your research, you should question, because it's our responsibility as doctors to teach you and help you understand why you would be doing a certain treatment, why you shouldn't be doing a certain treatment, and answer any and all questions that you have prior to actually getting on that treatment. So we do a thorough evaluation, we do comprehensive labs for blood work, and then one of our anti-aging experts assesses the different protocols that fit your body's needs. And we'll usually give you different options. If we think that testosterone replacement therapy is the best option, that'll be an option that we give you, but we'll also give you the non-hormonal options as well. First thing I want you guys to look into when you're talking to your clinics or practitioners, and that is, you need to make sure you're injecting or you're intaking the highest quality of medications. So when it comes to injectables, usually they come in a suspension oil, right? So a suspension oil, 99% of commercially produced testosterone cypionate is in the suspension oil known as cottonseed oil, right? Now, cottonseed oil is not a food product. We're not meant to intake cotton, right? So that is known to be very, very inflammatory and actually quite harmful and strenuous for your liver to process it out, right? Contrast that to what we use at the clinic. It would be a non-GMO grapeseed oil. Now, grape is a food, and it's actually not inflammatory. And it's a lot easier for your body to process that out so that you're not harming yourself in the process. So again, demand better from your practitioner. So we monitor blood work every 8 to 12 weeks. The industry standard for blood monitoring while on testosterone replacement therapy is between 4 and 6 months. So the reason why we do every 8 to 12 weeks is because we want to have our finger on the pulse of what's going on. If your labs are looking exceptional on one blood draw, that does not mean that in 6 months they're not going to change. So we want to make sure that every 8 to 12 weeks we're seeing what's going on, making sure everything is still looking great, because if it's not and certain levels are getting out of where they need to be or out of range, we can course correct, make sure that the dosing is right, make sure that the actual medication is right, and then proceed with care. Our biggest thing is being very discreet and customizing all of the therapies for our patients. Most of our patients do their labs in LabCorp or Quest. We do the interpretations over the phone or via Zoom. And then the therapies are actually mailed straight to you, to the house. So it's a very discreet, very concierge approach to care, which is what we pride ourselves in. And because of the concierge approach, we take the guesswork out of doing testosterone replacement therapy. There's a lot of guys that come into the office asking, "Doc, so what do you think about this? What do you think about that?" The last clinic that I went to, they wouldn't lead me in the right direction. I would have to look up stuff on YouTube. And at that point, honestly, anybody's an expert on YouTube. Doesn't mean necessarily that they know what they're talking about. Maybe they have experience, but the more likely they may or may not be qualified to be giving medical advice. So make sure that you're going to a place where they're working alongside you for this process, as opposed to just telling you what you need to do, sending it to your house, and then just checking in every 6 months. So I hope I touched upon everything that you guys were expecting. Now, if there's any other questions that you have that were not touched upon here, I'm happy to answer any and all of them. Myself or one of my medical team advisors will be able to jump on a call or a Zoom call with you to answer any questions. There's 3 ways to get in contact with us. Number 1, you can call the clinic. The clinic number is 754-206-0838. You can also text that same number, 754-206-0838, and they can schedule a complimentary phone call with one of our practitioners. You can email the clinic, that's info@getbiocure.com, or you can just take out your phone and just scan this QR code right here. This QR code will take you to a landing page where you can just submit there. You say you want a hormone consult, and for referral, just say you heard about this from the webinar, and it'll be a free phone consultation. You can schedule it on your own time. Our options are live and on our Google Calendar, so you can fit yourself right into one of our spots that works for you, and we'll be happy to answer any and all the questions that you may have. So once again, guys, thank you very much for coming in. Thank you guys for registering. Hope you guys learned something, and I look forward to speaking to you soon. Have a great rest of the day.